I've been talking a lot about FCR, the fractional coral calcium treatment, a Korean resurfacing treatment that works magic on so many issues that we have. I've been successful in treating hyperpigmentation with it. I've been successful in treating acne, cystic acne with it. I've been lucky to be a part of a community online of women in my profession that share a lot about all the new treatments, Korean new treatments, and I'm amazed with what I'm getting. So a lot of my clients don't really understand what actually is going to happen and how the healing process is going to go, actually what they're going to feel also. It is a new uncharted territory. It's not like any other chemical peel. It is a peel of sorts, but it works a little different. We also like to call it natural microneedling because these little spicules or the little tiny micronized coral calcium goes in your skin and it pushes your skin to resurface from inside out. That is the best way to resurface because we don't want to treat only what's on the top all the time. That will get us results, but not in a long run, and it will also not treat certain issues that sit a little deeper in the skin, like cystic acne, like hyperpigmentation. Those dark spots, they're not dark because they're only on the surface. They're dark because there's layers of hyperpigmentation that is sitting inside of our skin, and the treating with microdermabrasion or the facials, they're great for lightening it, but the actual root of the pigment is still sitting inside. This treatment is best done in a series of 4. It can be done every 2 to 4 weeks, depending on each skin type and your schedule. I like doing it at 2 weeks. I've seen great results at 4 weeks too. I'm gonna do one on me, and then I'm gonna do probably another one in 2 weeks. My issues right now, my skin started freaking out a little bit. I changed my birth control. So ladies, if you change your birth control, do not think about anything else. It is that. And I wanna kick this. I don't want it on my skin. So first thing I'm gonna do is cleanse my face, and then I'm gonna lightly exfoliate it. And then after the light exfoliation, I'm gonna do the FCR. FCR is 3 products. One is a powder and 2 are liquid. One liquid is geared towards acne, and one liquid is geared towards hyperpigmentation. I usually mix them because the acne one pushes the skin to resurface a little more, because when we have those acne that are sitting inside, the cystic one, we really need to push that up. So to get like those great anti-aging benefits too of resurfacing your skin, I like to mix them because we want to have a good peel. The peeling process is a little different than with chemical peels, especially much different than like TCA or peels of that sorts. It doesn't take off as much straight away, because what it does is it really kind of slowly pushes it up. Treatment by treatment, it makes the pigment resurface more and more. So after this light exfoliation, there is an optional step of numbing. I numb a little bit most of my clients, so I'm gonna do the same for me. The feeling of FCR is not as strong as microneedling, but it does feel like I'm tapping and rubbing something pretty sharp. So numbing always takes that edge off and it makes it a little easier to do. So while I'm still numbing, I'm gonna show you what FCR is. It comes in a little tiny bag like this. That's where the powder, the coral calcium is. And then I have two liquids, one for acne and one for hyperpigmentation, depending on the ratio of these. That depends on how the treatment is gonna, which way it's gonna go. As I said, I like mixing them because they both have benefits for hyperpigmentation and acne. And also, I keep only talking about acne and hyperpigmentation, but with any kind of resurfacing, and especially with this good kind of resurfacing that goes from inside out, you get a lot of diminished fine lines, the texture evens out. The large pores that we are all quite worried about, they appear large just because we have a build-up of skin cells that are sitting on top and they're making the texture look pretty bad. Once we resurface the skin, those pores go back to their normal size. Of course, there's other things that help with the pore size, is keeping them clean and keeping them empty. And I'm not talking about blackheads. I'm talking about keeping the your pores not build up with sebum that is produced inside of them. A lot of things help with that, but number one thing it would be a good cleanser with glycolic or salicylic or lactic acid. I love the Image Ageless. It is one of my favorite cleansers. It has 11% glycolic and it really does the trick. Okay, I'm gonna now mix my FCR, one pump of each, because I have some dark spots and I have this new acne that just showed up. Echo, what's the time? What's the time left on the timer?
You have 30 seconds left on the timer.
30 seconds. Just in time. Okay. So we have an option of tapping, rubbing, massaging. It really depends on you. I usually start with tapping and then I kind of try to gauge what you feel and what you can take. Echo, stop. I also have these fine lines that started appearing in between on my forehead, and I really want them gone. Don't we all? So I'm gonna spend my full 2.5 minutes right here too. The whole massage takes 10 minutes. And depending on where is your area of concern, I spend a little bit longer there than the other. As you can see, I'm rubbing and massaging quite strongly, and I'm a little bit of a baby with these things. You would think that I can handle it all, but to be honest, I'm not that good with with pain on my face. And this feels, again, just like I'm rubbing like sharp, tingly little things. Again, nothing unbearable, but I can definitely feel it going in my skin and doing all the magic. I'm also a little bit on the sensitive side, so I usually get pretty red. Or let's correct myself. I always correct my clients. I'm not on the sensitive side. My skin is not sensitive, but my skin is very reactive. So even with microdermabrasion, I get quite red, and it all subsides really quickly. Some of you that are reactive, they have reactive skin, you know what I'm talking about. Now I'm gonna go on my chin because that's where I started breaking out. Our hormones play a big part of our whole body, but it really shows up on the skin. Okay guys, because it's my first one in the series and I can feel it pretty sharp right now, I'm gonna stop on 6.5 minutes of rubbing, but I am gonna keep it on for the rest of the 10 minutes. After the 10 minutes has passed, I'm gonna apply a cooling hyaluronic gel to soften up and start the calming down process. So I never make your skin super upset and then just let you go into the world like that. So after we've started the regeneration process, I apply this mask. I'm gonna keep that on just a little bit, and then we're gonna take off the actual FCR and apply a different cooling mask. Okay, the time has passed, and I'm gonna wipe off the FCR. So after all that talk of how reactive my skin is, you can see I'm not even that crazy red. And the whole feeling, I can't call it burn, because it doesn't burn. Not like a chemical peel, but the feeling of the spicules of the coral calcium has already subsided significantly. And now I'm gonna follow it up with a very calming sheet mask that will calm my skin even more further on. I do expect to have the same feeling that stays for usually around 24 hours. I did have some clients tell me they felt it a little bit longer, but each treatment we go ahead with it, less you feel it. Okay. like nothing happened. I'm gonna apply my sheet mask. And I'm gonna let my mask sit for 20 minutes so my skin would calm down completely. Also know that in this following days, if anybody touches your skin, it will reactivate it again. So I have a 4-year-old that loves touching my lips and my face, so I'm gonna do my best to get him to stay off of me. I moved my mask a little bit, but that's okay. These are tricky to put on when you're sitting up. You see the redness that stayed was on the chin where I rubbed the most. A little bit on forehead. The aftercare for this treatment is very minimal. It is just recommended to do very, very light. I'll give you really calming cleanser and then moisturizer with sunblock. You want to be protected. And just keep it moisturized and calm. The peeling should start around the day 3. I'm going to be taking all the pictures and taking good notes of my progress. That way you know what you can expect. Thank you.